All right, Anush, we are live.
Hi guys, I'm Anush. I'm an injector nurse here. I have Steven. He's getting facial sculpting today. He's a really handsome young man. And what we're gonna do for him today is actually just define a little bit more of the structure that he already has. Beautiful cheeks, beautiful jawline, amazing chin. So what we're gonna do is work a little bit more on his jawline, make his jawline look a little bit stronger, and it's gonna complement his chin. We're gonna give a little more symmetry to his chin, bring his cheeks up just a little bit medially, and it's just gonna be nice lifting. It's gonna give him a refreshed look, not so tired, right, Steven? And we're gonna also take care of his temples. So give a little bit more volume to his temple area. He's interested in getting eyebrow lift. This is gonna help him with eyebrow lift. Later, we're gonna do Botox. But for now, it's facial sculpting with fillers.
All right, guys, I have some questions going on. Let me answer these. These are not filler questions, but they are lipo questions. Someone said, I need gladiator done, and another person is asking, Dr. Jason, how far back are your surgery appointments? I need to get a consultation and have my surgery done by August. You guys need to send us a DM with your full name, email, and phone number. We will have our consultation. People reach out to you and get you scheduled. We can also try to make happen what you need done. So now, Anush, how long do these fillers last?
The fillers last about a year. For every patient, it might be a little different. For some patients, it will last less depending on your metabolism, and for some patients it will last about a year and a half. We usually like to see you back at least in a year. Some of the fillers that we do with facial sculpting on the first treatment, we're gonna do a lighter treatment to just see how it works for you, how much you like it, and then we'll see you back in 2 weeks or in a month, and then we'll work a little bit more.
We have a question here for our patient. They're asking, does it hurt?
Painless.
And we did numb our patient beforehand.
Yeah.
We did topical numbing for those of you asking. I know I have a lot of doctors that come on and ask.
We definitely do topical numbing. It makes it more comfortable. Fillers itself has numbing too. The filler comes with lidocaine, so it will numb the area even more after we start injecting. Okay, it's already looking much more defined.
Guys, this is not painful for our patient. He is doing well. He has been numbed. He is feeling great.
Not painful at all. Painless.
It's actually a pretty painless injection, getting injection done around your cheeks and the temples and the chin, jawline. Sometimes lips are painful. These areas are pretty comfortable. For most of our patients, we don't hear any complaints.
We have someone calling our patient handsome. We'll read that off for him.
Our patient, Steven, is definitely handsome.
No names.
It's, really a pleasure working on his face. Facial sculpting is one of my favorite treatments because you can have so much done in one treatment for both females and males. Male facial sculpting is different from female facial sculpting. Whenever you're doing facial sculpting for males, especially, make sure you go with a provider that knows how to do facial sculpting for males.
Yes, we do offer FaceTite, guys. We do have some amazing results on our page. If you do to get a hold of us for that, send us a DM with your full name, email, and phone number. Or you can email us appointments at jasonemermd.com. We do virtual and in-person consultations for you.
Okay, so we are gonna give him a little bit lift and support with the temple filler.
Let me show one side to the other.
And you can already see the difference even with a little bit.
There you go, guys. Look at that difference. I have much more fullness there.
Yeah, and this is an area that a lot of time is not injected, and people forget about it, but it makes such a huge difference. Temples are a really deep structure, so if it gets a little bit hollow, it makes the whole face kind of fall down. So we like to keep it up. We like to prevent it. It's a preventative treatment for a lot of our young patients. We need to make sure that the temples are just full enough, not overfilled, definitely, just enough. So we did the cheeks, we did the temples. We're gonna move down to his jawline, and that's how we usually work from top to bottom. And again, he has a beautiful jawline naturally, which is gonna give it more of a strong chiseled look, right? That's what he wants.
Can you just give me just a napkin because it's very warm in here. We couldn't have aircon because of the light.
You just gotta look. It is a very nice,
Very hot.
sunny day out here in West Hollywood.
Yeah, and whoever is not
Enjoy
from
our
LA,
view.
LA is beautiful weather today. It's really sunny, warm. A good
Very
day
hot
to be
today.
at the beach, but we're gonna make it there, right, Steven?
I'm gonna go to the pool after this.
Pool.
Exactly.
No, and so, guys, this is not Botox. Botox will be done later. As you can see, we have it over there, ready to be done by Dr. Emer.
We usually do Botox after we're done with fillers. Okay, so now we're gonna work on creating a little bit more stronger jawline. So in the way we work with the filler, for the jawline and for more of a structure, we make it mimic a bone structure pretty much. To create more of a stronger look. Jawline and chin are areas that take more filler. And sometimes you might need more than one treatment, especially if you want to go slow and, do a little bit, come back in a couple of weeks or in a month. Then we can take a look.
So let's show
at it
one
again.
side of the jawline to the other right now.
Mhm.
So you guys can see this side I've done right here. This side is not yet been filled.
Yeah. Let me see. Let's see the difference. We already see a better structure, more of an angular look here, more of a chiseled look, and we're gonna work a little more on this side. Just because it will complement your chin so much. Patient, a facial sculpting is pretty much art. So you just look at the face and you make it look more balanced. A lot of times we're able to also improve symmetry.
You're sweating here today.
It is.
It's very warm.
Yeah, even if it's not painful,
No, it's not painful at all. I literally can't feel a thing. It's just a very warm day today.
Perfect. So we're gonna move to this side. And I'm just gonna take a look and make sure we compare one side to another. Perfect. Looks really great. So let's move to this right side. Do we have any questions?
No, we have no questions right now.
And whoever is joining just now, again, my name is Anusha. I'm an injector nurse here at Dr. Emer's clinic in West Hollywood. And we have Steven,
No names.
a really handsome patient who's getting facial sculpting today, men facial sculpting. We're gonna show you the before and afters later, so you'll see what a difference it can make.
You wanna wipe off?
Can I go wipe off? Thanks. 100 degrees.
So here's all the fillers, guys, over here. This we have done. We're going to do Botox next for our patient.
And we're using Voluma today for most of the facial sculpting. Voluma is a really great filler. It lasts longer than other fillers. It also has a really great ability to mimic bone in the areas where we need more structure. It's one of my favorite fillers. This treatment usually has no downtime. There might be a little bit swelling, not significant. Sometimes there might be bruising, usually no bruising. How are you feeling, Steven?
Good.
So the injections are done really, a lot of them are deep around the bone area. It's not painful at all. Sometimes you hear the filler going in and it's weird, but that's pretty much all. Perfect, looks so great.
That was definitely painless.
That's good. And we're gonna work on the chin. He has a really nice chin, but giving it a little bit more symmetry is always a good idea, especially when you're working on a jawline. It's always good to work on the chin too. So what we're gonna do, we're gonna give it more symmetry. Again, we're gonna use Voluma.
Can you pass me a little more of that, two more of those?
Yes.
People must think this guy's got like a sweating condition.
If you guys do have a question, feel free to ask it to us. We are ready for your questions. All right, so is it true once a person gets Botox, the muscle will never go back to how it was before?
No, that is not true. So Botox has a temporary effect. What it does, it pretty much relaxes the muscle. And once the effect of the Botox is gone, the muscle regains its strength. For some of the muscles on our face, that would have been a desired effect for the muscle not to regain its strength, but for now we have to keep up with the Botox treatment, so you need to do it regularly, usually every 3 to 4 months. Just because once it wears off, the muscle regains the strength. Over time, with age, your muscles might lose the strength. And you might need to adjust the amount of Botox that you need.
Is cannula better or straight injection?
It depends on your technique. It depends on the area injected. So under eye is one of the areas that you always use cannula. and I shouldn't say always, sometimes you will need to use a needle to just get more precision. Generally with the needle you can get a better precision. Cannula is also a great tool. Just like I said, facial sculpting is like an art, so you use your tools as you need. It's very individual, and luckily,
Will the filler affect his facial hair growth?
no. So the filler is not going to affect his facial hair growth. The filler is in a layer, it's injecting in a layer where the hair follicles are not even there. But regardless, the filler itself is a hyaluronic acid filler. So hyaluronic acid is natural to your body. You have hyaluronic acid in your body. So what it is it's not going to cause any type of reactions in your body. We don't see allergic reactions. We don't see side effects as far as it's not truly a medication. It's just a hyaluronic acid cross-linked in a way that it creates more of a stable structure than the hyaluronic acid that you have in your body. So as we know, hyaluronic acid is also a reversible filler. In case you don't like it, you can reverse it. We don't see that often. I truly don't see people wanting to reverse it when it's done correctly. But that's kind of an option that gives you a peace of mind. I'm going to give a little bit more support here to prevent him from getting myriad lines down the road. So the smart way of doing filler injections is making sure you take care of whatever you need to take care of now, and also preventing whatever issues can come with age or normally we see happening with age. So it's both treatment for improving current concerns, but also preventing. Perfect, looks good. Right, and we are done with the facial sculpting portion of our treatment today. We're still gonna do Botox to relax his muscles. The Botox will be for around his eyes for the CrossFit, to give a little bit more height to his eyebrows. We're gonna prevent him from being able to use his muscle between his eyebrows, the glabella muscle that creates this 11 lines. We don't want that. We want a little bit more relaxed look, because once the 11 lines are created and you have that indentation, it's harder to treat it. So we just want to make sure to prevent it. Now it's going to be our next treatment.
All right, so let me give a quick pan. Let me show them the results right now. All right, guys. Thank you. Thank you, Anush.
Thank you guys for joining us today.